Welcome, Dr. Flood. Thank you for joining us today.
All right, thanks for having me.
So, first question, what drew you to choosing ophthalmology as your specific area of study?
So my uncle has worked for a manufacturer of some of the surgical equipment, and so he was kind of the initial exposure I had to the field. Ophthalmology is a pretty small area within medicine, and so a lot of medical schools, you can go through your entire training in medical school and have limited exposure to ophthalmology. So he kind of got me in that direction, and then I knew that I wanted to at least look into it. So I have to give him credit for that.
That's awesome. Family connections.
Mm-hmm.
So why would somebody need to see an ophthalmologist?
So there's a lot of things that can affect the eye. You know, the most common diseases that affect the eye are, cataracts. Cataract surgery is really the only way to fix cataracts. Diabetes can really cause a lot of problems in the retina. Glaucoma is a disease that affects the optic nerve and can cause you to go blind. I mean, glaucoma is a blinding disease, and the tough thing about that is that you can lose vision and not necessarily realize it until it's pretty advanced.
Yeah.
So there's a lot of things. Macular degeneration is another one. That's a common one. And these are all things that we can do things for to improve vision or prevent vision loss. And so those are really the main the reasons that you might want to see an ophthalmologist.
Very good. So have there been any new recent developments in your field?
Yeah, ophthalmology, one of the things I love about it is that there are so many new developments. So, 10 or 15 years ago, we didn't have the medications we have to treat things like swelling in the retina from diabetes or macular degeneration. So those medications have really allowed us to preserve vision in people who otherwise would completely lose their central vision. So there's a lot of new technology that allows us to image the retina and see things that we weren't able to see before. In glaucoma, there are new micro-invasive glaucoma surgeries that allow us to lower pressure in the eye with a lot lower risk than we were able to do before. So it's just an exciting field that changes like every year. There's new things that come about, and so it's just, for me, it's an exciting thing to be able to kind of share and experience with patients.
Yeah, it sounds like you're very knowledgeable, very on top of the new technologies.
Well, that's part of what motivates you to come to work and to be able to do the new best things out there and try to improve people's vision and their eye health.
That's wonderful. So just to get to know you a little better, what's your favorite pastime? What do you do off work?
So I like traveling with my wife. Before I came here, I grew up originally in Tulsa, and so I'm happy to be back in Oklahoma. But before we came here, we kind of traveled out west, and I had never really done that, and it's just beautiful. I mean, it's just like a beautiful country, and seeing all the a lot of the national parks out there, it's just gorgeous. So we like going to places and seeing new things and doing things like that. So, and being near family has been great here. So I like spending time with my siblings in Oklahoma, and one of them lives in Oklahoma still, and then my mom in Tulsa. So.
Well, that's awesome. Thank you so much, Dr. Flood, for being with us
today. Well, thanks for having me.
We appreciate you taking the time.
Yeah, thank you.